For those struggling with substance use disorder, the road to recovery can be tough to navigate. But at Community, the Bridge program is making that road more accessible, and it all starts in the emergency room. In a system where access to addiction care can be complicated, the Bridge program is meeting patients where they are.
The Bridge program is really how we bring a lot of the best practices related to harm reduction, addiction medicine, public health, prevention medicine, right here where all of the patients are, which is here in the emergency department and in the hospital.
Emergency medicine Dr. Rais Vohra says the goal is to connect people to recovery services, whether it's their first time asking for help or they've been through the process before.
We're going to be open and approachable and let them know that whenever they have a problem with substance use disorder, whenever they need help getting referrals into recovery programs, whenever they need their prescriptions started for addiction medicine related issues, that we're going to be ready to serve them.
The Bridge team is now taking what they've learned from opiate treatment and applying it to alcohol addiction, another misunderstood public health crisis.
We've come to the recognition that it's not just fentanyl, it's not just opioids, that there's this other big issue that probably got worse during the pandemic that we really needed to address. And that issue is a very common issue of alcohol addiction.
The stigma around alcohol use can keep people from asking for help in the first place.
With these medications, they don't necessarily need to stop drinking. It's just these medications are going to work on the different sort of chemicals and neurotransmitters in their brain to where they will internally want to stop drinking so much. And then instead of having 10 drinks every night, which I know sounds crazy, but that's exactly what our alcoholic patients tell us. Instead of having 10 drinks at a time, they may have one or two and then just stop, which is exactly, that's the goal.
And when 1 in every 9 patients has a substance use disorder, every visit is a chance to step in.
That's a massive number of people, almost 10% of our population that we see every single day, has an issue that we need to intervene on. But that's actually really good news too, because while we see them in our hospital and in our emergency department, we're going to be able to offer them those interventions, whether that's a simple counseling, just a simple session of just talking to them, which is called brief intervention and screening session, or starting them on medications, either right in the emergency department or through a prescription.
Dr. Vohra says it's more than just treatment, it's about prevention, because alcohol use is linked to heart disease, liver failure, and even cancer.
We need to treat alcohol the way that we did cigarette and really just say, how can we phase this out or keep ourselves safe from it?
And for anyone struggling, Dr. Vohra's message is simple.
I would say just start. There's really no wrong way to enter into your recovery journey. The important thing is to start as early as possible. Don't try to do it alone. This is a team effort, and it is something where you want people that are experienced and are going to be able to help monitor your recovery, and really that know exactly what the network of resources is.